major organs and or structures include two kidneys. Remember, the kidneys filter the blood and produce urine, which is going to be carried from the kidneys to the bladder by ureters. So you're going to have a pair of ureters. Remember, the word is pronounced ureter. In a clinical setting, you don't ever want to say ureter. People may not say anything, but they'll think stuff. Okay? The ureters drain the urine into the bladder, where the urine is housed until the bladder fills up. When it fills up, then it's going to trigger contraction of the detrusor muscle. That's an important word, detrusor muscle. That's the smooth muscle that lines the wall of the bladder. Okay? And so once the bladder contracts, then urine is going to be excreted via the urethra. There's only a single urethra to the outside environment. Now, what are some of the functions of the kidneys? Well, they filter the blood, so they remove excess volume, okay, and they regulate the composition of the extracellular fluid in terms of electrolytes, waste products. Now, I said they remove excess volume. That's true. Sometimes we're volume depleted, in which case they hold on to volume. So a better term would be regulation of volume. Okay? They maintain the proper electrolyte balance. When I say electrolytes, I mean sodium, potassium, chloride, all those important ions that are present within the bloodstream. And they play a major role in pH balance. You know, all of those enzymes that participate in metabolism function optimally at a pH that's close to about 7.4. So the kidneys play a major role in maintaining that pH right around 7.4. We talked about the fact that they get rid of waste products. Kidneys play a role in blood pressure regulation. What pathway do we think of when we think of the kidneys?
The renal angiotensin.
The renal angiotensin pathway, right. Okay. How do they play a role in red blood cell production? What do they produce? What is that hormone that's important in red blood cell production?
Erythropoietin.
Erythropoietin, you got it. They play a major role in vitamin D metabolism. The active form of vitamin D is synthesized within the kidney. You know, vitamin D production begins in the skin. Due to the effects of ultraviolet light. We produce in the skin vitamin D3. But then that vitamin D3 travels to the liver where it gets hydroxylated. An OH group is added. So it's like 1-hydroxy vitamin D3. But that's still not the active form. From the liver, that intermediate goes to the kidney where it undergoes a second hydroxylation. It becomes 1,25-dihydroxy D3. Well, that's the active form. So, and vitamin D, by the way, is important for what?
The absorption of calcium.
Yeah, it's necessary for the absorption of calcium from the gut. And then, now, the kidneys don't play as an important a role as the liver and pancreas in glucose metabolism, but it's a site where gluconeogenesis occurs. Remember that if you become hypoglycemic, if you've been starving, pancreas produces glucagon, and that stimulates gluconeogenesis. Well, one of the major sites of gluconeogenesis is in the kidneys. So it does all this stuff. Now, you look at the kidneys when we dissected the dogs. They are retroperitoneal in location. And a bean-shaped organs like this. Okay? The medial margin through which the vessels enter, we will call this brains. This is called the hilum. Very analogous to what we see, for instance, in the lungs. That medial margin through which vessels and lymphatics and nerves and other structures either enter or exit is called the hilum. Okay. Now, just inside the hilum, there's a space called the renal sinus. It's really a potential space because the kidney, that space, that sinus, is occupied by these blood vessels and the proximal portion of the ureter called the renal pelvis. So you find a renal pelvis, you find blood vessels as they enter and begin to divide. Okay, and you find a lot of perinephric fat within the sinus. So it's more of a potential space than a real space because it's occupied by structures that are serving the kidney. And then perched on top of the kidney like this, like a little dunce cap here, is the adrenal gland on either side. And here we see a couple of kidneys, a couple of kids running around. Here are your kidneys. Now, proximal part, look here how the ureters, they expand proximally to form this renal pelvis here. This renal pelvis is collecting urine that's being formed within the kidney to then deliver it into the ureters and so it can be stored within the bladder. Let's talk about some common terms with respect to these structures. What would you call an infection of the bladder?
UTI.
Well, a UTI isn't specific for the bladder. That means that somewhere along this tract, you could have an infection of the kidney, and that's still a type of UTI. Give me a term that would be specific for the bladder. How about, have you all ever heard the term cystitis? Okay. So if you had an infection of the bladder, what we call cystitis. What would you call an infection of the urethra? Urethritis. Urethritis. What would you call an infection of the kidneys? This one's a little bit, this is not intuitive, this. It's called pyelonephritis. Yeah, it's a little bit great. Pyelonephritis. And they're very different in terms of the etiology and clinical presentation. For instance, what do you think is the most common organism that causes cystitis? Anybody have a clue as to what's the most common? Have y'all taken micro?
Yeah.
No. What's the most common organism in the lower GI tract? What's the most abundant organism? Little son of
What?
Escherichia coli.
Yes, that's what I was thinking of.
Escherichia coli. E. coli.
My tongue.
Well, it turns out that the most common causes for cystitis are infections by organisms from the GI tract. Who gets cystitis more frequently? Males or females?
Females.
Why is that?
Because I would think we have like more access to that area. I don't know.
Well, you're right.
More open, right?
Yeah.
Well,
Stay in the folding more.
It's a matter of proximity. Let's see if we can. Run back. let's put the urethra right here, okay? And this perianal region right here tends to be contaminated by a lot of lower GI organisms, particularly E. coli. Okay, so there's not much of a distance between this perianal region and the urethra. And remember from micro that these E. coli have flagella that allows them to move, to swim. And so there are certain factors which predispose women to recurrent infections by E. coli and similar organisms in the lower GI tract. They're called coliform organisms. One is the fact that the urethra is short and it's located very close to the anus. Okay. And so it doesn't take much for those bacteria to make their way to the urethra, and they can swim up into, because the urethra is short, they can swim up into the bladder. Sometimes they're assisted. For instance, you know when you're young, your mom always says, make sure you wipe from front to back. Well, for some people, that lesson is never learned. And so they'll wipe from back to front, and they'll drag these organisms into the region of the urethra, which is going to predispose them to infection. Okay. That happens a lot. And you'd be surprised how common a problem this is. I would say that cystitis is a really, really common, it's a common cause for people coming into the outpatient clinic. And sometimes the same people come in repeatedly. And sometimes it's because no one's ever stopped to ask them questions about their personal hygiene. And if somebody would do that, you could potentially, if not eliminate future cases, at least decrease the frequency. Sometimes you have to ask very personal questions. What do you think is another cause of, what else contributes to UTIs in women? Intercourse.
Yeah.
Intercourse. Back in the day, probably around your grandma's time, a lot of women didn't have sex until the night of their honeymoon. And so what would happen is during that week following the honeymoon, they would develop a cystitis. And people would call it honeymoon cystitis.
Wow.
Okay? Have you all ever heard of that, honeymoon cystitis? Okay. So, and again, it's just a mechanical thing where sometimes sexual intercourse will then take these bacteria that are in the perianal region and bring them further forward to the urethra. But you have to ask patients, do they know the same relationship between sexual activity and these episodes of UTIs? Sometimes they do fine, except with certain positions. Okay. Sometimes they might be fine if they have intercourse using what's called the missionary position. But if they take a different route, if they take the back route, that's what seems to trigger it. So, is it easy asking questions? No, not necessarily. No one feels real comfortable, but unless you do, you're not going to prevent these future recurrences. Sometimes, even if you do everything right, they tend to recur with each time they have sex. So what do you have to tell them to do? To avoid right after having sex. Okay? Because voiding is part of our innate immunity. It flushes out bacteria. Okay? Sometimes, though, the problem is so bad that they have to take an antibiotic every time, prophylactically when they have sexual activity. Okay? Yes?
So how do men
It's not as common. If men get it, it's usually on the basis of developing an infection first in their prostate. Okay, and it backs up into the bladder. Okay, but because men have a long urethra and it's further away from the anus, it's much less likely.
Is there,
Oh, the other thing that happens is when people go into the hospital, instrumentation. Someone has a Foley catheter that's placed and either they don't use sterile technique, and so it introduces bacteria, or they leave that Foley catheter in too long, allowing time for bacteria from the outside to make their way up that catheter into the bladder. So you never want to leave a Foley catheter in for a week or longer. You know, if someone needs a Foley catheter for a long period of time, you need to be changing it and using sterile technique.
Is there anything that like can genetically predispose you to like
I think there are certain people that are genetically predisposed. You know, with those, and there's probably multiple factors involved. You know, if you're on immunosuppressant drugs, that would be another cause. If you have to undergo a cystoscopy, any instrumentation, that would predispose.
there's nothing that your body like produces that it may overproduce or underproduce that could cause
Yeah,
it?
that's something that bladder mucosa produces, a mucin that has antibacterial or bactericidal properties. And for instance, as women age, they produce less of that mucin. And so as you age, you're more prone.
Okay.
Okay. Now, if you do have a urinary tract infection, most people, cystitis is a relatively mild infection. For instance, most people who develop cystitis may have some urinary symptoms, but they don't have a fever. In fact, most of the time, they don't even have an elevated white blood count. Okay. But does that mean it's symptom-free? No. What kind of symptoms might be associated with a cystitis?
Pain with urination?
Frequency. Mean that you have to urinate more frequently than normal. Or urgency. Okay. That when the need comes, you feel like you better get there quickly or else you're gonna, as people say, pee your pants. Dysuria. What does dysuria mean? Yeah, it's usually a type of burning with urination. You can have urinary incontinence. Sometimes you can have pelvic or flank pain with bladder infection.
It's incontinence. Is that just like
Not being able to-
flow?
You may leak some. Okay. You urinate some. You get foul smelling